Hello, my name is Kirsten Schemberger, and this is my presentation on group thinking. So first I'm going to start out with what exactly is group thinking. So I really like this picture, and I think it does an awesome job explaining what group thinking is. So group thinking is a phenomenon where people tend to conform with a group's decision to avoid feeling like an outcast. So they usually agree with the consensus and don't express their actual doubts and judgments. Which then this can cause errors to occur in decision making because many times they ignore any ethical or moral consequences. So in this picture here, it shows everybody above the table stating their agreement, but inside they're really thinking, oh no, this isn't going to be very good. So I'm going to explain an example where I experienced group thinking behavior. So the scenario was a couple months ago at the facility where I currently work. We were changing chief clinical officers and they were changing CEOs, and there was a lot of confusion going around on the floor, as well as many things were not working very well at the facility. Some of these things include nurses were angry about not being appropriately staffed, inadequate pay, lack of support from management, and broken equipment. We were having a lot of nurse turnover because of this, frustrating even more employees. So the environment that it took place was at an acute hospital, and the whole group thinking started at the nurses' station when nurses started collaborating what their issues were. And also around this time we were to have CEOs of the company actually come in and talk to our employees of why all of this was happening, why we were losing so many employees, and what the main issues were. So this group thinking, pretty much everybody collaborated on what they think they should tell the CEOs and what their issues were in relation to the facility. So what role did I play in the group? My initial thoughts were completely different than my actual actions. At first I wanted nothing to do with it. I thought that it was just another gossiping or drama at the nurses' station. So I just sat back and kind of listened to the whole group. But then as the conversation went on, I felt as though I was kind of recruited and people were asking me my opinion. So I started voicing my opinion of what I thought the issues were of the facility and what I thought that we needed to bring to the CEO's attention. So what behaviors were actually present in the group thinking session? There was a lot of different behaviors, as well as some employees showed more than one behavior at different points in the conversation. Curiosity was shown because some individuals wanted to know how other people felt about certain things. Anger was showed because they were tired of particular things happening in the workplace, so it started people started raising their voice out of frustration. People became spiteful. They started talking down on management and wanted the current management to be fired. Individuals started being persuasive, saying why one thing should be higher importance than another, and they wanted people to say certain things to corporate. They were also considerate. Some people were concerned about how patient safety played a role in what was going on in the facility, such as short staffing. Other people were scared. They didn't know what the future entailed. They didn't know what to expect when the CEO and corporate came into the facility. So according to Kuhn 2011, there is 8 warning signs on how to identify whether group thinking is occurring. The first one that I recognized in this scenario was that illusions of invulnerability were occurring. This is when the employees of the group were ignoring the obvious dangers and were not weighing benefit versus harm. The employees did not realize that they could get fired or that the facility could shut down due to the issues they brought to the CEOs and corporate. The next one that I saw occur was illusions of unanimity. That's when they counted silence as a consent or agreement. Not everybody that was a part of the group thinking voiced their opinion, but everybody especially the leaders, thought that everybody agreed with what they were saying. The next one that occurred was stereotyping. Not everybody agreed with everything that was going on. Some people said, oh, well, it could be worse, or it's not too bad. And the people that were leading the group thinking talked bad about them and stated, how can you think that way? The other one was pressure to conform. So that was when, in the group thinking session, they tried to coerce members to support their consensus. So they would say, well, what do you think about this? Well, why don't you think this way? And tried to persuade them to thinking in the way that they wanted them to. Did anybody give in to the pressure to conform? Yes, most definitely. The who that was involved included myself as other coworkers. Initially, I know myself, I did not want to get involved at all. I didn't want involved in the drama or the conflict. But then eventually, after everybody started discussing valid points, I wanted to get involved, as well as suddenly I had the same opinion that everybody else did, even though it was different. Why did this happen? A great example is peer pressure. I didn't want to be the oddball out or voice a different opinion. And then I also, if I did voice a different opinion, I didn't want it to start a conflict or people to look down on me. And the other reason is I thought to myself, if everybody else is doing it, why shouldn't I? Which is a very poor way to think of things. The picture in the bottom right corner I really like because it shows a picture that everybody has follow me on their back, and then eventually they all conform and do exactly the same thing. And they're pretty much doing something that's pointless, which is just walking around in a circle. Does group thinking affect behavior and performance? Most definitely. It had an effect on the department as well as everybody's work performance. So initially I think it brought everybody together because everybody had something to talk about and voice similar ideas, whether or not they agreed with them. However, it changed everybody's attitude when coming to work. Some individuals dreaded going to work because they knew of all the issues going on. People had increased anxiety, myself included, because I didn't know what to expect, whether or not the facility was going to close, who was going to be our CEO, what management positions were people going to take. And then this started, for everybody, causing a lack in performance, especially because more people were gossiping and talking bad about the company than actually performing their duties. Did the roles of the members of the group affect performance and behavior? I think the biggest group leader was one of the charge nurses, and I think especially when people worked with that charge nurse, they had different opinions about her, as well as that charge nurse, that's all she wanted to talk about and pretty much get everybody amped up. Therefore, it took away from patient care. So there is many steps to prevent group thinking. Some of them include encouraging debate, allowing others to bring their own ideas and opinions and not pretty much trying to conform them to one idea. Reaching out is another one, inviting others from different backgrounds, personalities, perspectives, or even departments to join in the discussion. Another thing is if individuals are not affected by the ideas or changes, they are great to stay mutual in the discussion. Another one is slow down. Do not reach an agreement so fast. Fast decisions can indicate that individuals were scared to speak up or intimidation was a factor. There is never any dumb questions. Set the rules so everybody knows that they're free to think how they wish and speak whatever is on their mind. Another one is assign an individual to be a devil's advocate. So ensure that all sides of the topic are being discussed, including cons, not just the pros to whatever the decision might be. Alright, so last but not least, here are the references I utilize in my presentation. I hope you enjoyed the scenario that I shared and the overall presentation. Thanks for watching.